The objectives of this half-day symposium are to do the following. Number one, highlight the magnitude of the problem being childhood uveitis. The burden of visual disability associated with that. It's bad enough to be an adult and to have inflammation that's chronic and damages vision. It's infinitely worse to have that happen in a child with 85 years worth of living yet to do facing you. So the burden in childhood uveitis is much greater than in uveitis that begins in adulthood. Some of the different things that can cause uveitis in children are going to be addressed so that you know that there are things, not just juvenile idiopathic arthritis associated uveitis, there are other things that can produce the problem too. To emphasize and emphasize and emphasize yet again the importance of early referral to a team of specialists. It's a pity that we try very hard to attract eye doctors to come to this meeting, especially pediatric ophthalmologists and pediatric rheumatologists. And year after year, from my perspective, it's disappointing at how few actually come. And much of this meeting is aimed at just that audience, trying to make sure that those eye doctors understand that although the child's uveitis doesn't seem like such a big deal today, or next week, or next month, or even next year, over the lifetime of the chronic inflammation and chronic steroid use, it is an enormous problem, and you'll see that theme come back repeatedly today. And so we'd like for doctors and parents to understand the importance of moving beyond steroids. Steroids are fantastic, first developed in 1940s, first used in a human being at the Mayo Clinic in 1949, brought to ophthalmic use by Dan Gordon in New York City in 1950, and they changed the world. They are unbelievable. There's nothing like steroids to snuff out inflammation quickly. But chronic use is 100% of the time associated with trouble, and usually big trouble. And so moving on past that to so-called steroid-sparing immunomodulatory therapy is the standard of care in the offices of the experts around the world today. So with that, let me introduce you to the faculty. Dr. Anisi, who is on the faculty at Mercy, will be speaking directly after I'm speaking here this morning in this introduction. He's a handsome fellow, and I think you'll also discover that he's incredibly smart and knowledgeable in this matter of pediatric uveitis. Andrea has agreed to speak today too. I've cared for her daughter who has uveitis, and I've cared for her for many years. This woman is a force for change. She is just full of brilliant ideas and energy in doing things in the way of support, education, and fundraising for this passion of hers. Jennifer is at Children's Hospital. She is a social worker, and she will be addressing the matter of being the parent of a child with a chronic disease. Nita Sen is from the National Institutes of Health. She has participated in this meeting in the past and has generously agreed to do so again this year with lots and lots of travel trouble from DC last night, arriving finally, I believe, at Logan Airport at midnight. So cut her a little slack if she seems drowsy. Dr. Patrick Whalen, who is a bicoastal pediatric rheumatologist. Specifically, he has a practice at the Mass General. He has a practice at an academic hospital in Los Angeles, California. Go figure. And he also has participated in this in the past. He is making that trip from California to Boston about 3 times a month. So refer to the last page of your syllabus for the evaluation and continuing education information sheet, especially for the physicians who are attending this. One does get continuing medical education credits for having come to this meeting.